Colorado officially decriminalized psychedelics. Other states probably follow. So let's talk to somebody who knows, shall we? Dr. Matthew Johnson, a professor of psychiatry and behavioral science at Johns Hopkins, one of the world's most published scientists on the effects of psychedelics on mental health. Doc, thank you, especially for this week.
My pleasure.
So, I use the term microdosing on purpose, not because that's what you're about, but because it is all the rage. You only need a little bit. You only need a little bit. Do the microdosing. Sprinkle it in. You'll never know. And it can make a world of change. What do we need to know that the research shows?
The research has, by and large, been with so-called heroic doses, very large doses, in fact, larger than most recreational doses. And so far, under the conditions of these studies where people are prepared and they're monitored and certain vulnerabilities are screened out, things have looked very promising, meaning very large reductions in depression, anxiety, depending on the compound, PTSD, addictive behaviors, both tobacco and alcohol. Looks very promising, not ready for prime time, but depending on results within the next few years, may reach FDA approval for medical use. However, there's been only a handful of studies on microdosing. This idea of using a tiny, tiny amount that doesn't even make one trip, but has a very, very subtle effect and there's a lot of anecdotes of benefits. So there's only a handful of studies on that. None of them have really dug into therapeutic applications. In other words, they've just studied this in people to understand its basic effects, people that don't have problems that need fixing. But so far, none of the results have indicated any of the purported benefits that people are claiming it. But the science is early. It may be that we as a field haven't done the studies in the right way to detect those benefits. I think there may be something there particularly for depression, just given the how it works on the serotonin neurons. I think that's a very plausible possibility. But if the microdosing work, it's going to be a little more like traditional psychiatric medications where you have to take something on a routine basis rather than with these large doses, the heroic doses that have been the basis of research so far. 1, 2, or 3 times seem to have profound benefits even a year later.
Let's talk about it. Why psychedelics? Give it to me in the mouth breather form. I'm no scientist. Why psychedelics would do anything good, and what is tripping?
Yes, psychedelics have really powerful effects on the brain. They have specific effects on neurotransmitters. Most of the so-called classic psychedelics, they have effects on a subtype of serotonin receptor. It introduces a profound effect on consciousness. The research is suggesting that even in rats, different forms of neuroplasticity are unfolding after giving a psychedelic. Neuroplasticity means the brain, the cells in the brain in different ways are more flexible. They're more susceptible to change. They're more adaptable given the circumstances. So, that combined with some of these, early results in the clinical trials where we're seeing these large reductions in many of these clinical symptoms, and combined with the mental health crisis. Basically, it's been decades since there have been really major advances in the treatment of these mental health disorders. And psychedelics are just a very, very powerful way to perturb and affect the nervous system. We know there's a lot of risks, very much dependent on when and where and how and who takes them. But these are very powerful tools for the mind. So the idea that they could have a positive effect. Yeah.
Let's talk about why and how it's not for everybody. I mean, look, I even feel like this about weed. Because people talk about weed like it's all the same, when some of this stuff that they grow now with guys like you figuring out the science behind it is not just weed. You can trip off of this stuff. So what are the safeguards? What should people know before they even think about trying anything like this?
There's definitely risk. Obviously, there's legal risks for most folks, but beyond that, folks that are susceptible to disorders like schizophrenia and disorders like that, they could be destabilized. There's some evidence suggesting that a powerful trip could destabilize that, worsen the symptoms of those disorders. People with severe heart disease, not
Hey, thank you for watching. please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.